Hello and welcome back to another episode of Live and On Call. My name is Allie, and as always, I will be your host. If this is your first time joining us, Live and On Call is a live streamed, interactive conversation where we bring Lake Charles Memorial Health System physicians live and on call right to your computer, tablet, smartphone, or whatever you're viewing this video on. We'll start with a discussion with our guest first, and then we'll leave some time for questions from you. During the chat, feel free to drop your questions in the comments below. We're all here to learn, so just don't be afraid to ask questions. If you prefer, you can send us a direct message during the live stream, and we'll be checking those questions as well. If you enjoyed today's episode, you can find all of the recordings of all of our past topics, including women's health, mental health, colorectal cancer awareness, and so much more on our website at lcmh.com/video. All of those videos have been live streamed previously, but so you can kind of refer to the questions in the comments if you're looking for questions to be answered. But mainly, this is some really great information to share with you and your family. So let's get to today's topic. Our guest is Dr. Taylor Clements. He's an internal medicine physician with the Memorial Medical Group, and we'll be discussing whole food plant-based diets. Dr. Clements, you are now live and on call.
Hey, thanks for having me, Allie.
Yeah, we're so excited for you to join us. I'm so excited to break open today's topic. I know this is a topic that you're really passionate about, and I'm excited to learn more myself.
Yes, super passionate about it. It's good to be here.
Cool. So, this is a great topic. Now we're 18 days into our New Year's resolutions. Maybe a few days back into some old habits from 2022. So I'm excited that maybe we can get some tips and some tricks and learn a little bit along the way. So
Yeah, I'm definitely already backslid on mine, so it'll be great.
Same. So before we get started, do you mind kicking us off, sharing a little bit about your background, maybe what led you to becoming a physician?
Yeah, sure. So I guess what led me to becoming a physician in general was I just really liked the biology courses that I was taking, like in high school and in college. Um, at one point, I was trying to decide whether I was going to teach science or maybe do something like medicine. I took an education course in college and I hated it terribly, and so I was like, all right, I guess it's the other way. But that's what I like about my job is I get to do a lot of teaching one-on-one with patients, like 15 to 20 times a day. So it's a little bit of both.
A little smaller class sizes.
Right, a little more manageable.
Right. So tell me a little bit about the patients that you see coming through your door.
Sure, yeah. So internal medicine is basically like adult medicine. So anyone 18 and up, basically, tends to skew a little bit like a lot of geriatric patients, lots of people with multiple medical problems that need finessing, but we really see the entire spectrum of adults. We just don't see kids, essentially. It's primary care. What I do is primary care, but I don't do the children's side of things.
Awesome. So for those listening in today, just a reminder, if you have any questions, go ahead and put them in the comment section below, and we'll get to them in just a little while. But let's get to the meat and potatoes of our topic today, or I guess in this case, just potatoes.
Yeah, right. Most of the time.
Over the years, you have seen patients manage many chronic diseases. I know you're passionate about advocating for whole food, plant-based diets with your patients. Why is this? What have you seen?
Well, so during my residency, my last 2 years of internal medicine residency, I did some extra training in lifestyle medicine, which is basically just how our lifestyle choices affect our health. So it's nutrition, it's physical activity, sleep, connectedness, and avoiding risky substances like alcohol or tobacco. But really, um, diet and nutrition is so important. It's probably the one I focus on the most. I touch on all of them with my patients, or I try to. But basically, if you want to, I think of it this way: you look at if you were to Google the top 10 killers of American, this past year, man, every time I look it up, it's about 8 of them are nutrition related. It used to be that we died from infections and we could cure you with antibiotics, but now we're dying of lifestyle diseases. That's what most Americans are having trouble with, like heart disease, stroke, diabetic complications, cancer, and almost all of those top 10 are diet related. So that's, we have to use the cause to reverse what's going on. You can use medicines to help manage those things, but I really like to address the underlying cause. And that's what really speaks to me as a doctor. So it gets me excited about my job.
Yeah. So what I'm hearing you say is that so many of these diseases are preventable should you have the right lifestyle choices in place. So um, let's talk about you kind of alluded to this, talking about the role of medicine and the role of food. How do they differ? And can this is kind of the main point of this topic is can one replace the other?
Yeah. So they, in my mind, when it comes to these lifestyle diseases, medicine and food kind of have different um, effects. So, and it's not one or the other. I do, as an internal medicine physician, I start a lot of people on medications that will, in my opinion, make them healthier, reduce their risk going forward if they have certain risk factors. But it's not take this medicine and keep eating whatever you want, you'll be fine. It really, we don't have the data to support that, but so medicines, when it comes to these lifestyle diseases, like if we take diabetes, for example, we have lots and lots of medicines that can reduce your blood sugar and keep you from getting really terrible complications like eye disease or foot disease, nerve disease, kidney disease. The medicines have been shown to do that. But a lot of these medicines don't fix the macrovascular, so the vasculature of the heart or the brain. They don't really reduce stroke risk or heart disease risk. Some of the newer ones are starting to help with that too, but what and they don't reverse diabetes. So just because your sugar's at goal and you're on medicine, that's a great thing, and that's a big part of my job. But we haven't addressed the underlying cause. If you were to take those medicines away, your sugar would go right back up. Whereas if you really attack the underlying cause of the problem, which is essentially nutrition related, diabetes is sort of our body's reaction to the foods that we're putting in. If you address the underlying cause, you can go into something that's called remission from diabetes. That's when your numbers are normal. You're not having any symptoms of the disease for 3 to 6 months, and you're not on any medications. And a lot of people that I talk to don't even know that's possible. So that's a big part of my job is saying, hey, did you know we could help you go into remission? And they're like, what? I've never been told that before, so that's huge. Just getting that turning point in people's minds. Like, I don't have to just keep managing this. I can actually do something to kind of fight back.
Yeah. A lot of people when they get diagnosed with some sort of chronic disease, they that feels like to them that that is ongoing for the rest of their life. And so I'm sure that's great news to patients. It would be great news to me if I was in that situation as well. So we should have probably done this at the beginning, but let's define some terms. We're talking about plant-based nutrition. Does plant-based mean vegan or vegetarian?
Right. So there's a lot of confusing nomenclature about this stuff. So vegan essentially means no animal products, or vegetarian often means no meat, but you might drink milk, etc. And so the thing I tell a lot of patients is Oreos are vegan, right? So there's no animal products in an Oreo, but that does not mean it's a healthy choice for you to eat day in and day out. So
Darn.
what Yeah, I know, unfortunately. So what we're talking about when I talk to patients about plant-based nutrition is really something called whole food plant-based nutrition. So whole foods meaning unprocessed or very minimally processed, and then plant-based. So the majority of your calories coming from plants. And so some people take that to the extreme and they eat only unprocessed plant foods. Some people eat 90%. They're still getting a majority. Or um, the important thing to remember is the closer to 100% you get, the more benefits you have. But I don't want people to be discouraged if you feel like you can't swear off meat for the rest of your life that you shouldn't try anything, because that's certainly not true. You can get a lot of the same benefits from eating mostly plant-based.
Yeah, so that kind of brings me to my next question. What about the concern for maybe the lack of protein if you're mostly eating plant-based foods? Lack of protein, or maybe some of the other nutrients that you gain from meat, like iron. And I've heard that argument before.
Yeah, so I would just start by saying I've never ever seen a protein deficient patient. It just doesn't happen in America. It doesn't happen in developed countries where you have access to food. Um, Even the vegan patients, I've never seen anybody deficient in protein. So it's important. I think we think of meat as protein, protein as meat, and it's important to remember that every food contains all three of the macronutrients, so carbohydrate, fat, and protein. It's just in different levels in that food. So, meat has a high concentration of protein, but it also comes with a lot of things that are not good for us, like saturated fat and cholesterol, and usually like a lot of sodium, et cetera. So yeah, it's important. Another way to think of it is think of the package, that nutrient's coming in. I don't like to talk with patients about get this much protein, this many carbs, because who really knows what that is? I like to talk in terms of whole, like real foods that they can look at at a grocery store and recognize, eat vegetables, fruits, whole grains, instead of saying, go get this many grams of carbohydrates. Like what does that even mean? I don't know how to count carbs, and so think about the packaging of the food. You can get protein from meat. You can get protein that's in really high concentration in a lot of plant foods like beans or peas, legumes like lentils, whole grains contain a lot of protein. And so essentially, if you're eating plant-based and you eat a varied diet, like you're not just eating baked potatoes for 3 meals a day, you'll get enough protein. It's very rare. But I will say the only nu- uh, nutrient of real concern, if you are going to go 100% plant-based, you should absolutely take a B12 supplement. That's the one and only nutrient that's a real concern if you're not eating animal products. Just take a B12, and that's essentially it. There's some others that you might want to, if you're a bodybuilder or you're looking to build muscle mass, then yeah, you might want to pay a little more attention to how much protein you're getting. Or let's say if you have low bone density like osteoporosis or osteopenia, and you need to know how much calcium you're getting, you might want to look up some plant foods that have more calcium if you're omitting dairy. um, but for the general population, if you're wanting to go full plant-based, the only one you really need to watch out for is the B12.
Awesome. So just a reminder, those of you who are viewing, if you have any questions, feel free to put them in the comment section below. I see we have a few coming in already, but we'll get to those in just a second, so stay tuned. I have a few more questions for Dr. Clements before we get to yours. Um, so how much of the positive impacts have you seen in patients that comes from losing weight from the diet change? Does that make sense? That maybe you're going to lose weight maybe if you're consuming less calories. Could some of that be linked to like a weight loss?
Sure, yeah. So they've actually done some studies to try to tease out, and it's sort of ridiculous if you think about it, but I can think of one in particular where they took patients with diabetes and they wanted to see if a plant-based diet could lower their A1C, which is their average blood sugar, compared with a normal diet. And they made the plant when you eat plant-based, you kind of naturally consume less calories because there's so little calories in some of these plant foods, and they're so bulky that you fill up, which is one of the great things about a plant-based diet. But in this study, they made them eat so much plant food that the calories were equal. So they wanted to see if would it lower their A1C regardless of weight loss. They tried to not let them lose any weight, but still eat plant food, and they did lower their A1C more than the normal diet group. So some of the benefits are from weight loss, but that's a pretty good side effect to have, right? Weight loss, side effect of this diet might be weight loss is usually a pretty good thing, and that's often the source of a lot of the symptoms for a lot of patients. They're like, I've had, a few patients over the years that have gone like 100% on me, and some of them surprised me, and they come back and they are a lot lighter, and they're like, man, I couldn't even walk to the mailbox because my knees were hurting me so bad. Now I don't notice my knees at all, and that's just from the extra weight putting pressure on those joints. um, so yeah, some of the benefits are tied to weight loss. Some of them are irrespective of weight loss, it seems, which is kind of interesting.
Yeah, definitely. I can't imagine how much salad or how much kale someone would have to eat to
That
be
sounds kind
normal
of
calorie
uncomfortable.
and to be yes,
Right,
not fun.
exactly.
I would not wanna be part of that study.
Yeah.
Um, so just kinda wrapping things up, what's your best advice to our deer hunting, sausage, and boudin eating community here?
Yeah, man, it's different here. I grew up here, but I trained in Texas, and I thought it was bad there. They have barbecue and everything. When I came here and I started suggesting to people to eat brown rice, they looked at me like I was crazy. And I've forgotten how much people love their white rice here.
Yeah.
But my and this is something I struggle with. I come home and it's like, like I'm currently, I eat mostly plant based. When I'm at my best, probably somewhere above 90%, and sometimes it's lower than that, depending on how crazy life is. And but what I struggled with was like, okay, I'll just eat this stuff on a special occasion, right? Well, when you move home and there's family around, it's like every weekend is a special occasion, So that's my advice is sort of, if you're thinking about this, nutrition or lifestyle, but this food here is a big part of our culture. I think a lot of the rest of the country doesn't understand how big this is in our culture. And I didn't want to take that away from myself, so I still allow myself to eat that way on special occasions, but I kind of had to reframe what's a special occasion in my
Right.
mind, so that it didn't end up being once or twice a week. It's like, oh, I'm seeing Uncle so and so, so I'm gonna have some gumbo or whatever. It's like, well, maybe like birthdays, anniversaries, and that sort of thing.
Yeah.
Um, but it's like I said before, they've done this study, looking at thousands of people, and they basically wanted to see if you ate 50% plant-based or 70, 80, 90, 100, and what would the benefits be. And it's like a line, so the ones that eat 50% plant-based, they do better than the people that eat almost no plants, and the ones that eat 75, 90%, they do even better than the 50% people. So it's it scares a lot of people when I tell them they need to eat mostly plants, but that's the thing, it's mostly.
Yeah.
So try to get as close as you can. If that for you is just adding a piece of fruit in your lunchbox instead of a bag of chips, that's huge. That's a huge start. Some people, like, they need rules, and they're like, I'm going to eat zero meat, zero processed foods, and that's great. I mean, I've seen a lot of people do great like that. Some people need gradual baby steps. So that's what I tell them. Make a change for a few weeks and then see what the next change is going to be. Maybe you can switch up your breakfast for the next month and then attack your dinner later on. So
Right.
it's just kind of doing what works for you. And there's so many resources out there on the internet, podcasts and websites and documentaries and all these things to take ideas from. So just go googling around whole food plant-based nutrition, and see what speaks to you.
Yeah, I'm hearing it really definitely, resonates with me and with I'm sure with other people, you know, getting together with family, like you said, is such a huge part of our culture and, just, full disclosure, I do not eat mostly plant-based, but, I think one thing that I could take away from this is to be that person in your family. If your grandma is gonna be upset that you're not gonna eat her rice and gravy on Sunday, eat the rice and gravy and bring some salad or bring some sort of vegetable to, to pair with that main meal that maybe you can get your family on board too.
Yeah, and you can use like the crowd out method is another one that I tell people. Like, take your plate, and it used to be like rice and gravy on this half and like the sides on the other half, and just make it a quarter or
Right.
a fifth, and then crowd it out with the other stuff. Or I'll do sometimes is eat before I go over there, so I can have a
Yeah,
little bowl. You're being a part of the group, but you're not like having two bowls because you're starving because you ate a
right.
little something before you came. So there's all kinds of tips and tricks out there where you can still participate in the culture. That's been the
Right.
biggest adjustment for me coming back home, and I can feel that for a lot of people here. But hey, it's a learning process, so just
Mhm.
one step at a time.
Cool. So let's get to some of the questions in the comments. One question says, "What do y'all think of intermittent fasting for weight loss in women over 40?" You said y'all. I'm going to defer this to Dr. Clements.
So for intermittent fasting, I'm not up on, you know, haven't personally read a lot of the big studies on this, but what I'm hearing is it can be a good tool for weight loss. Essentially, if you restrict the time that you're eating in, um, then a lot of times you'll take in less calories, kind of by default. One interesting thing that I had heard was a study where they tried to differentiate people who fast in the morning or fast at night. Essentially, like, do you eat most of your calories in the morning or at night? And supposedly, eating more in the morning, less at night is better.
Hmm,
So it's kind of like eat a big breakfast, a medium-sized lunch, and then the smaller dinner. Try not to snack all the way through the night, kind of thing. Which is tough because for me, I could not eat all morning and I could fast till
yeah,
lunchtime, but apparently that's not the best way. So I don't know.
I guess it gives your body a little bit more time to work off those calories.
Right.
Another question is, do you recommend a certain number of carbs daily in someone who wants to lose weight, has no medical conditions?
So actually, no. I mean, I think it's more important for me to differentiate what type of carbs are you eating instead of a certain number or like weighing your food and all that. That can get kind of tiresome. But um, the studies on certain types of foods and weight show that whole grains, are a good choice for people who want to lose weight, or fruits, or even starchy vegetables. Those would all contain carbs, but they're natural foods, and the associations are that they lead to, weight loss rather than weight gain, as opposed to white sugar, white flour. They've stripped away all the good parts of that plant, right? You took wheat kernels and you took away all the brown stuff to make it white flour, or you took rice, you took away all the brown parts, which is where all the nutrients are, and you made it just white rice. And so the associations with those foods, or like sugar sweetened beverages or cakes or candies, is for weight gain. So I would focus more on the type of carb or the type of food rather than certain numbers.
Got it. Speaking of rice, we have a comment from Patricia who said, "I've replaced rice with rice cauliflower." I think that's a great option.
Yeah, that's perfect. Yeah, absolutely.
And then another question, you were talking about replacing or taking a B12 supplement with if you're going to go completely plant based. How much B12 do you recommend?
I think it's something about like 250 micrograms a day or something like that. So um, I think the lowest I could find at the store was like a 500 microgram, and I just take one like every other day. Um, but if you're going totally plant based, and to be clear, I mean, omnivores also get B12 deficient. So that, something you might want to look out for. But especially for totally plant based people, it's important to at least get, I want to say about 250 micrograms a day is the recommendation.
Okay, so we have another question. What are some plant based foods that are still inflammatory? In particular, maybe food with lectins should be avoided as well. Should those be avoided as well?
I don't think so. I mean, I've heard a little bit about this, like research. So there's certain compounds and certain plants that they use to like repel insects or stuff like that. And so the thought is that that is inflammatory in our bodies. I haven't heard any good research that says that actually has an effect. It's more of like a theoretical thing. or eating this might raise the level of this in your body. So we might want to think about that. But as far as like big studies, looking at thousands of people who eat this plant and they have worse outcomes, I've never heard of anything like that. So um, I think it's more of a theoretical thing at this point. I don't particularly worry about that too much.
I'm kind of putting you on the spot here, but are there any, I don't know, anybody online or anybody with some accessible resources for people that you would recommend? If you don't have them offhand right now, I could get with you later and we can put them in the comments. Any books or any particular um, dietitians or doctors or whoever that are reputable in your eyes?
Yeah, for sure. Oh, there's tons. The ones that I often recommend to a lot of patients are for a book. I'll a lot of times recommend one called Eat to Live. It's by Dr. Joel Furman. That's the one that originally introduced me to plant-based nutrition back in college. Um, and it's very accessible. It's an easy read, and it explains a lot of the stuff that we talked about today. If you're not so much of a book person looking for like a documentary, um, the kind of go-to one is called Forks Over Knives.
Yeah,
Um,
I think I've
it's
seen
a
that.
really good one. It's a few years old now, so it might be a little dated, um, but it's a good one to kind of take in all this information, go a little more in depth, um, and then there's a good website called nutritionfacts.org. That's by this guy, Dr. Michael Greger. That's kind of a nonprofit. He makes short videos explaining a lot of like frequently asked questions. He goes through all the science behind all this stuff. Um, and if you're looking for something kind of local, shameless plug for my wife, she has an Instagram account and a website called the Plant Based Cajun, and she adapts a lot of Cajun recipes to be plant
How
based.
awesome! That's
Yeah,
awesome.
so y'all should look her up too. She's got a lot of good stuff there for when you're trying to make little swaps, for our culture.
That's super cool. That is super cool. So we have one more question in the comments, and then we'll kind of wrap up here. But um, somebody, oh, we had two. So we have this first question: Will this change? Will this? Sorry. Will this change? Will this change have an effect on a 69-year-old Black man with heart problems?
um, yeah, I mean, absolutely. That and what I'm not sure exactly what you're asking, but it's definitely very good for heart disease. We have a lot of good studies that show the more plant-based you eat in the prevention realm, it's very good at preventing heart disease. We also have some studies that show people with heart disease who eat plant-based have a lot less coronary events, like having to go to the hospital or having chest pain or having to get a new stent. Um, so it's really good for heart disease. But if you do have multiple medical problems, you take a lot of medications, this can have a big effect on what those medicines are doing. So if that's your case, I would definitely do this in, conjunction with your doctor. Let them know, hey, I'm thinking about changing the way I'm eating. Can you let me know what I should do with my medications? A lot of times, um, as you eat this way, your blood pressure is going to probably go down on its own. And if you're still taking blood pressure medicine, that can make it go too low, right? So ask your doctor, what should I watch out for? Do I need to monitor my blood pressure, my blood sugar, and change my medicines if I see them going too low? Because that can happen, especially for those of you that might want to go 100% plant based. That might happen in the next few days, even needing to adjust medicine. If you take something like insulin or diabetes medications, you might want to watch things very closely and keep your doctor in the loop.
Yeah. I think that's a great point. Make sure you're telling your doctor what's going on, and if you're making big changes like that, especially if you're on medications or for other conditions.
Mhm.
Um, okay, so what do you recommend, or do you recommend any vegan protein shakes? Any particular ones? Things like Beachbody or Arbonne diets. So I guess plant-based protein shakes.
Yeah, so I think for the average person, probably don't need to worry about taking a protein supplement. If you eat a varied diet, like you're getting some beans, almost every day, or you're getting some whole grains. These all contain protein, so you're most likely going to get more than enough. But like we said earlier, if you're like a serious bodybuilder or you're like wanting to build muscle mass, so I want to make sure I hit this amount of protein per day, then yeah, that could work for you. There's nothing in particular like brand wise or anything, but it's pretty mainstream now, like plant protein powders and stuff like pea protein, etc. That you can get even at like Albertsons or whatever. So um, really, that's just if you're particularly concerned with like building muscle and you want to make sure you're getting a certain amount per day. But you could also definitely do that with whole foods too, just picking the right ones.
So what you're saying is you're not sponsoring any particular brand of
No,
protein shakes at this
if
time?
any companies want to sponsor me, I'll start making some recommendations. Okay, good.
That's hilarious. Okay, last question. This is really the last question. So, what are your thoughts on veggie foods, Morningstar, Beyond Meat, Light Life, etc.?
Yeah, so um, I think of those as like transition foods. People ask all the time, like if these are healthy, the plant-based meat alternatives, are they healthy? I think you have to consider healthier than what? Is it healthier than a bowl of lentils and brown rice? No, because they put some fats in there and some salt to make it taste like real meat, right? So, but is it healthier than a normal, like a Big Mac? Yes, absolutely, it's healthier than that. So I tell people, treat it as one of those every now and then things. Or if you're like somebody who's used to eating a burger a few times a week and you're looking for some way to get off of the burgers, yeah, switch out for the Impossible Whopper, and then try to transition onto more actual whole foods. So that's a processed plant food. So not as healthy as the unprocessed ones, but it can be really good for kind of taking the place of something that's maybe a not so good habit currently. So I encourage people to use them that way for sure. And for kids, like we keep a frozen bag of like plant-based nuggets in our freezer because for those days when we're like rushed and it's either that or drive through McDonald's, oh, we'll do the plant-based ones all the time. Throw them in the toaster oven, and our kids love them. They can't tell the difference. So that's an easy one to sneak some plant meals in.
Yeah, cool. All right. Well, is there anything else you want to add? Anything, any more advice or anything we missed?
Man, I think we covered a lot today, but it's one of my favorite topics to talk about, and the best part of my job. Like I said earlier, like I feel like being a doctor 50 or 100 years ago used to cure a lot of people because what they had were infections, right? And so you give an antibiotic and they're cured. And as time went on, we got people started getting these lifestyle diseases, and we're just doing a lot of managing, and that kind of gets boring to me, right? So I want to actually cure some people, put people into remission using food and all the other points that we didn't talk about today, like physical activity and sleep and avoiding substances and all that. So yeah, this is the best part of my job for sure. So if anybody wants to talk more, come see me.
Yeah, if you want to make an appointment with Dr. Clements, his phone number to his office is right here on the screen. His office is on Nelson Road at the MMG Internal Medicine Clinic of Lake Charles. So he is there accepting new patients, and I'm sure he'd be really happy to chat with you. And so, thank you guys so
Absolutely.
much for joining us. Dr. Clements, thank you so much. I had a blast. We'll have to
This
do
was
this
fun.
more often. This is great. And I loved getting some of your advice. I'm really interested. I'm going to go check out your wife's Instagram with her Cajun swaps. That sounds really awesome. So
She's
thanks
got
for
way more personality than I do too, so it'll be more exciting.
oh well, we enjoyed having you. We enjoyed this chat, and thank you so much. We'll see
Yeah,
you
thank you
guys
for
next
having me.
time.